Hi Emma.
Hello.
My name is Mickey. I'm going to be your nurse practitioner provider for today. I'm going to be performing a head-to-toe assessment on you. Nothing that I do should hurt. If you have any questions along the way, please feel free to ask. I'm going to wash my hands and then we're going to get started.
Sounds good.
So Emma, can you tell me your full name, please?
Emma May Royston.
And what is the date today?
November 6, 2020.
And where are we? What is this place?
Medical office.
Very good, very good. So now I'm going to assess Emma's skin. And I don't see any bruises, any wounds, or any signs of infection. I'm also going to check her scalp and her eyebrows. I don't see any signs of dandruff or any wounds or any abnormalities in there. Emma, go ahead and open real big for me and close, and open real big and close. I don't hear any clicking or popping, so there's no evidence of TMJ present. Now I'm going to check for cranial nerve number 5, which is facial sensation. And so Emma, go ahead and close your eyes for me and tell me where I'm touching.
My left cheek.
Where am I touching?
My upper right forehead.
And where am I touching?
My chin.
Very good. And then I'm also going to check for cranial nerve number 7, which will be facial movements. So Emma, if you could puff your cheeks for me, if you can raise your eyebrows, very good, and stick out your tongue. Very good, thank you. I would also have check Emma's vision by having her do an eye test with a Snell eye chart. I would inspect her eyelids and her conjunctiva and her sclera, and all of those things look normal. First, I'll palpate her lacrimal apparatus, and that feels normal. And I'm going to check for her extraocular eye movement. So Emma, if you could follow my pen with just your eyes. Very good. And I can also check for Emma's visual fields. Emma, go ahead and look here. How many fingers am I holding up?
2.
How many fingers am I holding up?
1.
Very good. I would also check Emma's eyes with my ophthalmoscope using my right hand to her right eye, and then my left hand to her left eye, and that looks normal. And I would also check for her pupillary reflexes using my pen light. So Emma, go ahead and look straight. And I would be making sure that her pupils were equal, round, and reactive, and both were constricting equally. Now I am going to check for auditory conduction. So using my tuning fork, I would hit it and place it on the top of her head. And I would be checking to see if Emma had any unilateral hearing loss. I could also use my tuning fork to check hearing loss by placing it on the back of the bone, and if the sound is heard longer in her bone than in the air, that would be a sign of hearing loss. I would look at her ear externally, and I would pull it back, and using my otoscope I would look in her ear, making sure that I visualized her pearly gray eardrum. That looks normal. And then I would check this side, checking her eardrum, and that looks normal. I'm going to check Emma's nose. Externally, it looks fine. I could look inside to just see if I see any swelling or any deviated septum. And then I could check her cranial nerve 1, which would be her smell, by using different smells and having her test that. So now I'm going to look at Emma's oral cavity and her gingiva. And so open big, Emma. So Emma appears to have really good teeth. She has no broken teeth, no missing teeth. Her gingiva is nice and pink. It's not red, no signs of gingivitis. Open big, Emma. I'm going to use my tongue blade to check Emma's gag reflex, and also to inspect her soft and hard palate and how well they move. I can also look at Emma's tonsils, and Emma doesn't have any tonsils. Hers were removed. And her uvula is nice in midline, and I don't see any signs of redness or infection back there. I'm going to inspect Emma's trachea. It's nice in midline. Emma does not appear to be in any respiratory distress. Emma, sit up, please. I'm going to come behind Emma, and I'm going to feel for her thyroid. Emma, go ahead and swallow for me. Good. I can feel it move up and down, and I don't feel any nodules or masses. Next, I'm going to check Emma's lymph nodes, starting in her face and neck, and going down her neck, and check her supraclavicular lymph nodes. And I feel no masses, no nodules. Next, I'm going to inspect Emma's chest. It looks equal and symmetrical. I would check it from both sides. Emma does not appear to be any respiratory distress. So next, I would take my stethoscope and I would auscultate, listening on both sides, up and down and across. And then I would do the same on her back in a kind of a ladder pattern. Very good, Emma. Next, I would inspect Emma's apical pulses, looking at her chest. I don't see any thrills or any heaves. Next, I would take the, actually I would have Emma kind of get at 30 degrees. And I would check for any jugular distension, and then I would palpate to see if Emma had any bruit or thrills, and I see neither of those things in Emma. Next, I would take the palm of my hand and I would take my pads of my fingers and I would check Emma's chest at all the important parts, her aortic, her pulmonic, mitral, tricuspid, and Erb's point. And then I would do the same thing with the ball of my hand, checking for any thrills or any heaves, and none of those were seen in Emma. I would also take my stethoscope, and then using the diaphragm of my stethoscope, I would also listen at the 6 relevant areas, the pulmonic, the aortic, tricuspid, mitral, and Erb's point. And then I would do the same thing with the bell of my stethoscope, listening in all 6 areas. Next, I'd have the patient lie on her left lateral decubitus position, and I would auscultate her tricuspid and her mitral valves with the bell of my stethoscope. Next, I would have the patient sit up, and I'm going to have Emma lean forward, inhale, exhale, and then hold your breath. And I would be listening at the left sternal border using the diaphragm of my stethoscope. Okay, so I would listen to, I would auscultate Emma's carotids bilaterally. I would auscultate her renal, her iliac, and her femoral arteries. I would also auscultate her abdominal aortic artery to hear for any bruits or thrills. Next, I would palpate her carotids bilaterally, her radial pulses bilaterally, and her femoral arteries bilaterally. And then I would do unilateral assessment of her radial and her femoral pulse to make sure that there is no lag in the pulse. I would palpate for an abdominal aortic aneurysm. Does that hurt?
No.
I would look at her overall extremities. I don't see any edema. It looks like she has good peripheral circulation. If I checked her pedal pulses and her tibial pulses, they're good within 2 seconds. I would check her lymph nodes. I would check her inguinal, her horizontal, her vertical, her axillary, and her epitrochlear to check for her lymphatic system. I would do an inspection of her abdomen. I would first auscultate in all 4 quadrants, and Emma has good bowel sounds. Next, I would percuss, hearing dullness over her spleen and her liver, and hearing some tympany in her bowel, which could be gas or stool. And then next I will palpate, feeling for any masses or an enlarged liver. If it would be appropriate, I would do a rectal, a vaginal, or a pelvic exam if it would be appropriate at the time. Next, I will do a neurological exam on Emma. It's obvious that Emma is awake, alert, and oriented. I look at her extremities. I don't see any atrophy. She's well nourished with good muscle tone. Emma, I'm going to ask you to push against my hands. Push. Now pull. Push. Good. Emma has good strength bilaterally in her arms. Pick up your legs. Okay, and push down. Good. Emma has good strength in her bilateral arms and legs. Next, I would check for deep tendon reflexes. I would check her biceps, her triceps, her brachioradialis, her patella, and her Achilles reflexes. I would also check for a plantar response. Emma, could you sit up for me? Take your fingers and touch your nose with both hands back and forth. Good. Emma has good fine motor skills. No ataxia appears to be present. And next, Emma, I'm going to check for sensation. And so like we had did earlier, close your eyes and tell me where I'm touching.
My left thigh. My right knee.
And is this soft or sharp?
Soft.
Is that soft or sharp?
Sharp.
Good. So next we're going to check Emma's musculoskeletal system. Emma, we're going to check your cervical spine. So if you can go ahead and put your neck down to your chin to your chest. Good. Now lean your neck backwards. Very good. Now tilt your head towards me. Okay, now tilt your head towards the other side. Very good. Now turn your face towards me. Good. Turn the other way. Good. Did any of that hurt you or bother you? Very good. All right, next we're going to check your flexion and extension. So go ahead and I'm going to hold on to your hips and you're going to lean forward and touch your toes. All right, stand up. So Emma has good flexion. Now you're going to turn, keep your hips straight and twist towards me. Good. And twist the other way. Good. Now lean your whole body this way. Okay. And go to the other side. That way. Very good. Good flexion and extension. No trouble up here. Bend your arms up and out. Turn your palms up. Very good. You have good internal rotation and pronation. We're going to look at your hands and your fingers and your wrists bilaterally. Next, we're going to check your hips. So if you can lift your hip, good, and do that on the other side. Good. I don't hear any clicking or popping. Emma, bend your knee. Good. Good. Good flexion and extension. I would look at Emma's feet and toes and make sure that she can flex and extend dorsey and plantar. None of that hurts. And she has good flexion and extension.